Hey, hey.
Morning, everyone. How's everyone doing?
Good morning. Good. How are you doing?
Good, good. Thank you.
Hi, good morning.
Morning. Okay, so let me just switch to our course outline. So today we're tackling the hair loss or alopecia areata. So let's start with some short videos, and then we're gonna go into our textbook. So just give me a sec. I'll post this into your chat area.
Today's topic is alopecia areata. Alopecia areata is a common autoimmune disorder that causes hair to fall out in small patches. These patches may take any shape. They are usually round or oval. Alopecia areata mostly affects the scalp, but may occur on any part of the body that has hair. The condition is due to an attack on the hair follicle by the immune system. The amount of hair loss varies from person to person. Some people may experience hair loss that is nothing less than a few patches, and others may be extreme with a lot of hair loss. Alopecia areata affects males and females regardless of age, though onset is mostly in childhood. In rare cases, total loss of hair on the head may occur, alopecia areata total, or total hair loss on the entire body, alopecia areata universalis. Causes: alopecia areata is an autoimmune disease in which the body attacks the hair follicles and suppresses hair growth. What triggers the immune system to attack the hair follicle is not known. Certain factors that predispose an individual to a greater risk of developing the condition include a family history of the condition, celiac disease, type 1 diabetes, rheumatoid arthritis. Symptoms: hair begins to fall out, mainly from the scalp. One or more well-defined spots of hair loss on the scalp. Thinning of the hair on the scalp. Itching or burning in the area of hair loss. Alopecia areata can also affect the fingernails and toenails. Changes that may occur to the nails are white spots and white lines appear. Nails become thin and split. Nails get rough. Diagnosis: your doctor may need to review your symptoms and look at the extent of your hair loss during diagnosis. The doctor may also need to examine some hair follicles. A scalp biopsy, where a small piece of skin on your hair will be removed for analysis, is performed. This is done to rule out other conditions that may cause hair loss. Blood tests may be performed to check for the presence of one or more antibodies associated with an autoimmune disorder. This is done if autoimmune conditions are suspected. Treatment: there is no known cure for alopecia areata. However, the condition can be treated. The aim of treatment is to stop future hair loss or help the hair grow back more quickly. The effectiveness of each treatment will vary among individuals. Some people don't need treatment as their hair grows back on its own. Certain medications, such as minoxidil, can be rubbed into the scalp to help stimulate hair growth. Steroid injections or corticosteroid creams and ointment can also be used. In some cases, to promote hair growth, photochemotherapy may be used. To help minimize discomfort, some certain steps may also be taken, including use of sunscreen to protect exposed area from sunburns. Wig, hat, or scarf can be worn to protect the hair. Alopecia areata associated with celiac disease may be treated with a gluten-free diet. This allows for complete and permanent regrowth of hair on the scalp and other body parts. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel.
Okay, so that was a very short introduction into alopecia areata. Questions, maybe comments so far?
I have two questions. We have patient actually at school who's coming in for a lot of problems, but she also has receding hairline. So they say that alopecia is just like bald spots all over the head. Could it be also a receding hairline could be considered alopecia?
To some degree, but generally that's not how alopecia works. Alopecia is not systemic kind of front that recedes, right? Alopecia is usually geographic, as you saw. Like, so you have spots somewhere that may or may not come back. But receding hairline is often more of a either chronic disease in the background and or aging or loss of major quality and quantity of substances in the body. So alopecia is more like a, guerrilla warfare on the body, like, hit and run kind of business. This, what you're describing sounds like more systemic, progressive, kind of debilitating condition, right?
Okay, I see. Okay. Thank you.
You're very welcome. Thank you. Any other maybe questions, comments at this point?
I'm also assuming that that's the same for like male pattern baldness, correct?
Yeah, that wouldn't be alopecia. I mean, what they share obviously with all this, or what Sarah mentioned, and you, it's loss of hair, but the mechanism is quite different. Unless
Okay.
it's, I would argue if it's totalis, right? Then you lost all of the hair, and then it really doesn't matter mechanism. It's probably not coming back. So alopecia totalis or universalis, when you lose it not just on the head, the whole body, that's just it. That's generally not curable anymore. Right. And then it becomes a bit more fascinating why it happens. I mean, to us from our end, while we cannot provide a cure, we want to know why this happened, because it's systemic. And then what else is in sort of cards for the patient, because we worry that, when you have that kind of event globally on a body, things will not just stop, right? Body doesn't work like that. That just, finishes with one thing and says, I'm taking vacation, right? Things will progress. Question is just in what shape, form, and how. And then so as a medical practitioners, we will pose and say, okay, we acknowledge, total loss of hair, or, on a head or whole body. What is the mechanism? How do we prevent future or further debilitating effects on that patient's health, right? Okay, let's go to Dr. Zhao. So she will present on alopecia. And then we're going to look in our textbook. So I'm going to put it in the chat area. I'll link to her presentation.
Drinking warm water before bed helps balance blood sugar levels overnight. Thousands of people are apparently...
大家好, hi everyone. Let's continue our Chinese medicine dermatology talk. Today's topic is alopecia areata. Now let's go to the slide. What is alopecia areata? There are a lot of information in the website. Generally, it is a term for hair loss. Alopecia areata is a specific common cause of hair loss that can occur at any age. It usually causes small, cone-sized, round patches of baldness on scalp, although hair elsewhere, such as beard, eyebrows, and eyelashes, body and limb can be affected. Occasionally, it can involve the whole scalp or even whole body plus scalp. It's not possible to predict how much hair will be lost. Regrowth of hair in typical alopecia areata is usually over a period of months or sometimes years, but cannot be guaranteed. The hair sometimes regrows white, at least in the first instance. Further hair loss is not uncommon. In alopecia totalis and alopecia universalis, the likelihood of total regrowth is less.
There's one simple vision hack anyone can use to improve vision, so you can say goodbye to your optometrist for good. Did you know that vision impairments have nothing to do with your eyes? The eyes are simply a camera for the part of the brain responsible for your sight. Here's the truth. No matter what type of glasses you wear or what eye treatments you try, you're only treating the symptoms, not the root cause. So listen up. Eventually, it will become harder and harder to see clearly, making you feel detached and less engaged in life. This is when your loved ones start to worry if you're able to manage on your own, and the next thing you know, you're relying heavily on others. But here's some good news for you. Top researchers from the University of Cambridge have made a startling discovery. While studying a lesser-known area of the brain, these researchers were stunned to find that all vision impairments stem from one single root cause. More importantly, they've unveiled a simple 7-second vision ritual you can begin to apply tonight, which is now scientifically proven to restore your vision back to clarity, regardless of your age or current eye condition. Even 70-year-old patients who were entirely dependent on their glasses for over 7 years are now seeing better than ever. I encourage you to stop what you're doing and click the Watch Now button below right now to watch a free informative video that will show you how to naturally reclaim your vision. Remember, no need for a doctor or spend hundreds of dollars. This is something you can easily do from home. Already over 110,000 people of various ages are using this 7-second ritual and can finally see clearly even in low-light situations. Just imagine, no more blurring, double vision or strain on your eyes. No more dealing with expensive glasses that never really help. Best of all, you'll finally be able to cherish the world around you again. However, the billion-dollar eyewear industry has twice before removed this special presentation from the internet in a desperate move to safeguard their profits. So it's uncertain how long this invaluable information will remain available. This time, click the Watch Now button below before it's too late.
Important news. Elon Musk's project has scared the government and
Please,
big
Lauren,
banks.
you've
He has
got
come up
ads
with a
going
new
on
secret
here.
investment that has made hundreds of people very rich. Last week, he appeared in public and announced his new project.
Sorry about that, guys.
Next slide. I have downloaded some photos from website. These are the very typical alopecia areata look. I leave the cause and symptoms and Western medicine treatment for you to do your self-study. During my 20+ years of Chinese medicine practice, I actually have encountered a few alopecia areata. Here's one. This is a 21-year-old girl. She wanted to have her own clothes factory, have her own clothes brand, and she of course suffered a lot of stress, and hair loss like this happened. There are more. This is only on right side. Left side has this kind of patches as well. And this is a man over 60 years old. We can see that's the left side hair loss. This is the during the first treatment, this photo, and this is later. I want to show you the hair regrow stage. This is after a few times of treatment, and this is very close to the final stage. That's the right side photo. You can see the hair loss is like this, irregular shaped patches, and hair regrows at first. The light colored hair regrows, and after a while, there were more dark colored hair regrow. And this is the back side of the head. We can see here are the hair loss patches, and here are the regrowed light colored hairs, and here are the later stage of hair regrowth with thickened and darker hair color and hair. Now we put our time more in the Chinese medicine part. In Chinese, we call alopecia areata 油风 or 鬼剃头. The main reason we consider is the wind. But what produces wind? Now let's look at the etiology and the pathogenesis. There are 3 different types. I will talk about them one by one. It's possible to have more types, but they mainly these 3 types. If you at the clinic meet other types, you just follow the Chinese medicine diagnose and treatment method, conduct your own treatment. It's easy. The first type is blood heat, giving rise to wind. Normally, stress, emotional factors, or other, say, life events or grief and loss produce the heart fire, blood heat, and then produce wind. Wind moves, causing hair malnourished and cause different kind of a shaped hair loss. The next type is deficiency of yin and blood. Long-term illness cause essence and the blood deficiency and kidney yin deficiency, which produce wind, make hair malnourished, and cause hair loss. We call 血虚生风 in Chinese. The first type we call 热盛生风. And the third type is blood stasis, 血瘀生风. Long-term blood stasis block the meridians, which include the collaterals, which is spread all over the body. New blood is unable to reach and nourish the hair, resulting hair loss. Now we talk about the treatment. In Chinese medicine, we have a few types of treatment. First, we talk about internal treatment. For the first type, blood heat giving rise to wind, the hair loss is sudden and in circular patches. The underlying skin is glossy, normal in color, or slightly pink, and accompanied by slight itching. The hair around can be easily pulled out. This type is more seen in the young people. There's no physical discomfort, but their stress or happiness. The tongue is often red with thin yellow coating. The pulse is very slippery and rapid. There may be restlessness, thirst, yellow urine, and constipation. Our treatment principle is cool blood, extinguish wind, nourish the yin, and protect the hair. The formula we use is this. This formula is not in a particularly formula name, but all the ingredients are here. It is formed following our treatment principle. With the modification, when the person is stressed, irritating, or angry, we can add 远志、珍珠母 or raw 石决明. 石决明 is the shell of abalone. Raw. Normally we use after charcoal or baked, but this is raw without any Chinese medicine treatment preparation, I mean. And now the second type is deficiency of yin and blood. The patient are normally weak, thin after long-term illness or giving birth. Giving birth can lose a lot of blood, can make person have blood deficiency. The tongue is pale with little coating. The pulse is thin, deep, or thin, rapid. The treatment principle is nourish in, tonify blood, dispel wind, protect hair. The formula we use to modify is 四物汤 and 七宝美人丹. 四物汤 here is 汤, D is not a D, it's a G. It's a famous formula for nourishing the blood. It only has 4 ingredients. Now, the formula is here. You can see this in nourishing herbs, blood tonify herbs, wind expel herbs, and hair producing herbs. When we see the patient have weak spleen, you can add 炒白术, 炒麦芽. When the patient has back pain, weakness, insomnia, which are the typical kidney deficiency symptoms, you can add 杜仲, 远志, 夜交藤, or 枸杞. It's different from 枸杞子. It's 枸杞. It's a kidney young nourishing herbs. The third type is blood stasis. Patient of this type often experiences headache or a piercing pain of the scalp before hair loss begins. The hair loss is in patches and the body hair may also be involved. It normally takes a long time for hair to regrow. The tongue is dark or has purple spots. The pulse is thin and choppy. Treatment principles invigorate the blood, unblock the channels, extinguish wind, and nourish hair. The formula we use to modify is 通窍活血汤. I put all the ingredients here. We can see there's a lot of blood invigorating herbs. Now we talk about external treatment. The first method, which is very useful method and simple, easily to be applied, very practical. So this, I put it first. We use fresh ginger slices, rubbing the hairless area until there's a sense of warmness. We can do it 3 times daily. We can do more than 3 times daily. If you can't make it 3 times daily, once or twice is better than none. Next time is practitioners will make 白芷 oil for patient. You can use raw herbs, or if you can change it to granules or powder. If you use raw herbs, you follow this method and then make a jar of the oil and then give to patient to apply by themselves. I leave to yourself. Now it's acupuncture treatment. It's very important. You can see I have used it in my photo. As the normal acupuncture treatment, we often choose local points, distal points. With this, we add one more method is using circling acupoints. For local points, we try to find acupoints because acupoints still achieve much better treatment result than ash point or other non-acupuncture points. We can choose the acupoints on the scalp, 5 to 6 points each time, once every 2 to 3 days. In Australia, it's very hard for patient to come to every 2 to 3 days. We can do twice a week or once a week at least to achieve some result. The 2 to 3 days frequency will bring better result than once a week. Distal points can combine together with local points. Here said once a day, but don't have to. Whenever you do the local points, you can do the distal points together. So patient only come to your clinic once. When we do the distal points, we choose spleen, stomach, kidney, liver, meridian points on the lower legs. So at the same time you do the head acupuncture, you can put few points on the lower legs, which we say one stone hit 2 birds. Encircling acupoints is, you can see from my photos, previous photos, in the hairless area, we insert needles around the hairless at the border. We insert needles in about 15-degree angle, and then put needle in towards to the center. Sometimes the needle top part can be in the hairless area under the skin, and then retain the needles there for 30 minutes, manipulate every 10 minutes, once every 2 days. It is ideal if you count, as I said before, at least once a week. And other treatment, which is plum blossom needling. In Chinese medicine, we call 梅花针 or 7-star 七星针. What we do is we gently tap the hairless patches with plum blossom needle until the skin is red or slightly bleeding occurs. So there are some tiny little bit bleeding points in the hairless area. And then we tap from the hair loss patch border towards to the center once every 2 days. Like the over 60 years old male patient, he lives 1.5 hour drive distance from my clinic. Of course, he can't come every day, every 2 days. It's very difficult. So I told him, go to your wife, ask for a comb, hair comb or hair brush. You just tap your own hair, tap the hairless area, tap like this, and then tap like 10 minutes, 15 minutes, as much as you can, 3 times, 4 times, as many times as you can. It's better than nothing. It is always helpful. Sometime when the treatment's limit, we can always use some replace method to help. Now the moxibustion, we use indirect moxibustion with ginger on the bladder 23, 深柱, which is at the back, bladder 13, 肺腧, it's 烂腧 at the back, stomach 36, TB5, GB34, stomach 36 and GB34, they are very close, they under the knee. We can do it after the back shoe points. And then we do when we do the back points, we can let the patient put arm up, and then we do the TB5. And then as patient turn around, and we do the stomach 36 and the GB 34. You can also put the ginger on the hair loss patches, and then put the moxa on the top and do the moxibustion. Treatment, again, should be ideally should be 2 to 3 days, every 2 to 3 days. 5 sessions is a course. But if you can't make it, you can't make it. You try your best to make it as frequent as possible. After each course, you have 5 days rest. Now, the last treatment method is counseling. As a practitioner, we actually do a lot of counseling. Myself has a counseling diploma. If you don't have a counseling degree, you can always do it part-time. There's no harm. They only can help you with your profession, with your practice. But if you can't, you can recommend patient to other counselors, psychologists. Now, our talk today stop here. Thank you for listening.
Okay, so we see Dr. Cao discussing her treatment of alopecia areata and associated modalities. So let's just switch to our textbook. So,
Ron, I have a question.
yes, please go ahead.
So in her second cause, she was talking about yin and blood deficiency, so causing a lack of nourishment and also causing wind, right? So if we stimulate the area, wouldn't that cause more wind because the root there's like emptiness, like there's not enough blood and qi?
In some cases, yes, in others, no. So we would, before we decide to directly stimulate local area, we would need to have really good diagnostic profile of the patient. So is the problem what we call biao, the branch, or is the problem a root, or is it a combination of both? So for root problems, we could treat the local area, and of course, systemically, we could treat other areas in the body to move the fluids and nutrients to the area. If the problem is the biao branch, so acute, then probably local treatment could be done, but probably more with the laser than with the metal needles, right? In addition to systemic. So we need to know basically the overall condition and constitution of the patient and the timeline and so on before we finally adopt the treatment to that individual. And then, of course, because Chinese medicine is a very personalized form of medicine, within 3 to 5 days, that patient may change, hopefully for better, but possibly for worse. So our treatment needs to be micro-adjusted again.
Gotcha.
So, yeah. So
Okay.
that's why, yeah, thank you. That's why there's a frustration on the side of students often when we study Chinese medicine, because there's no clear, very specific step-by-step protocols that we're used to watching the biomedicine, especially if they come from biomedical training. And they're like, how come Chinese medicine doesn't have this very logical step-by-step? And I'm like, well, it does. It's decided on a spot. We could give you a range of what you should do, but we could never tell you exactly how the treatment's going to look, because we don't know. We're not in a room with you, with the patient. It's you that you have to fine-tune that treatment. We can give you parameters, but other than that, we cannot. While in a biomedicine, you mold patients to medicine. We mold medicine to patients in TCM. That's a radically different philosophical look at holistic versus technologically dominating medicine that the biomedicine is. So they'll muscle the body with technology, with imaging, with everything. And, in interventional medicine, that's amazing. It saves your life. It overpowers the whatever is happening in your body. But in a chronic conditions, that sucks. It's just not going to do it, right? So each approach has its strengths and weaknesses, right? This is not a critique. This is more of a review. So when you study Chinese medicine, unless you're practicing interventional medicine, you have to think in this kind of chronic approach, which means that you reserve the right as a clinician every time to fine-tune the medical expression toward the patient that you will be directing, right? Very important to know. Okay, so let's look here in Atlas. So here we have some stories and pictures of the patients with various levels of alopecia areata, right? So we have the here bald spots in someone who's young as 8-year-old, right? And so, and often that could be in Western medicine, vitamin deficiency, for example. So like B6, B12, biotin, and others. Here we have alopecia totalis for more than 10 years in this adult. Notice how even eyebrows are affected slightly. And so there's no cure here with this bottom picture. This is total, and it's gonna stay that way. While it may stop there, luckily for patient, we should probably, as a clinician, get the sense of why this happened. Is it constitutional? Is it lifestyle? Is it constitutional and the lifestyle? And to what degree? If you look at person's lips, you'll notice they're very dry, shiny alike, right? If you look at skin, you notice various levels of redness in different parts. So chin, nose. Nose is a major young landmark on the body, often associated with the spine. And then so if you separate the face in 3 parts, so from chin to philtrum to basically nostrils, that's the lower jaw. From bottom of the nose up to orbital region, just where the eyebrows are, that's the middle jaw. And then from eyebrows up to the vertex, that's the upper jaw. So if you look at the person's ears, they're sticking slightly above orbital ridge of the eyes. So where the ears are in Yin Cheng, that tells us about a certain diagnostic things, right? So this person probably looking at, and then you look at the shape of the face, right? So the shape of the face is, it's more of like a metal shape of the face. So there's a squariness there, and then there's that like really defined chin, right? So this was a metal type that attracted phlegm, right? That caused the dryness. Here is the extensive alopecia areata for 6 months. Notice the geographic presentations. Notice that it's the back, so vertex and the back of the head, so more young side of the body. Of course, alopecia areata doesn't have to just be pronounced in the hair. Here we see it all over the body, including the beard here. So, and again, this could return or it may not. So here's alopecia areata where we have probably a fungal infection as well. How do we know? If you look at these black dots, that's a keratin. So Tinea capitis here, fungal infection is eating the hair, the keratin, because hair is made of keratin, same as nails, so protein. And we see here the fungus basically eating the hair, right? So it's alopecia due to fungal infection. Here is the growth of new hair, but that hair is gray and very thin. So middle-aged woman, 7 months of alopecia. So we would say that this was due to yin and blood deficiency. Why? Because if you look, there's a gray hair in surrounding areas, and then the hair is coming back, but it's not of good quality. It's a thin and it's more gray, which points that it started as a blood deficiency. Now it's also yin deficiency, possibly kidney gene deficiency as well. Here's another one, right? So patient who's presenting with hyperthyroid, which is spleen-Yang excess, right? So, so this patient has the symptoms of hyperthyroidism, and his TSH, thyroid stimulating hormone, that's secreted by pituitary gland, is low, right? Here's alopecia, obviously on limbs, right? Alopecia on the face, but here we have a follicle also infection, so folliculitis or folliculotropic fungal infection, because we can see it down on the chin. Now notice the pattern of it. That's pointing down to Yangming, so large intestine and the stomach area, right? So this individual has Yangming pathology. Okay, so let's go back to our textbook. So here we also have alopecia areata universalis, means this person has lost the body hair everywhere. So hair is gone, eyebrows, no beard, probably no. Universalis means no hair on the body anywhere. Here we see also a patch. The way this patch is presented points to possible regrowth possibility, because it's a clean surface. There's no bleeding, there's no major redness or paleness. So looking at the skin this way, there's a possibility of moving qi and blood into this area, increasing microcirculation and regrowing the hair. Also, when you're looking at the hair of this individual around, you can tell that it's shiny, it's strong. So this person has a strong blood and qi. So basically their zheng qi, their resources are fairly available. So with the proper treatment, we can have total regrowth. Here's the alopecia areata totalis. Notice the regrowth of the fine hair. And so that points to state of zheng qi, or overall basically resources. Totally opposite than what we saw from previous picture. So if you look at her ear, notice how the ear is like sort of pale, and then there's a redness down on a lobe, where we see basically robe represents on our ear the head, right? So this is a case of blood deficiency with pseudo heat, right? And so these this patient will probably face uphill battles in regrowing normal hair, because the body's showing that only fine regrow hair happens. Now, there is a possibility to regrow it if this is due to, let's say, if it's due to chemotherapy or radiation. And then usually we have like a bout of fine hair first, and then later when treatments are stopped and patient gets treated, if the blood and qi can be enhanced, the hair can grow back. Of course, if this patient has leukemia, then the hair will not come back. So it really depends on overall things. Here's the alopecia areata with we have extensive lesions. Note on a sort of bottom left corner, or sort of mid left bottom corner, there's a blood in one of the lesions. So it points to possibility of the blood deficiency and some pseudo heat here. Notice also there's a little speck of the blood, just a little right of that bigger blood ones. There's a tiny red speck in the center of the loss of hair. So this individual probably, when we're looking at it, has a multi-systemic issues, because hair is lost in multiple areas. So lateral part of the head, right? And then vertex. So we're looking at the gallbladder, we're looking at Shaoyang, we're looking at Jueyin because of vertex. So we're looking mostly at sort of what we consider a wood elemental aspects of the person's health, right? So maybe stressors. So as we can see, alopecia areata can come in various forms and shapes, from a singular lesion to multiple lesions to total loss, complicated also by other pathologies. So underlying pathologies of yin deficiency, toxic heat, pseudo heat, blood deficiency, blood stasis, Qi stagnation. So it's important to get a sense of what else is going on underneath, especially if the treatment is long-term, like months, which usually is. Very few patients, by the time they come to us, remember, we're the last bus station for lots of people here in this country, means they're not going to come to us right away. Why? Because they're socially conditioned. They have their socialized health system. They're paying two taxes. So they'll try everything before maybe they consider coming to us. Unless they're culturally conditioned to believe in Chinese medicine, in which case, rare, I gotta admit, they may come to us probably early because they're more holistically thinking. But again, most of us will not see them till they visited general practitioner, then specialist for hair, then maybe a naturopath, homeopath, and someone else. And so by the time they come to us, they have probably months, if not years, of alopecia, which is complicated by partial successful treatments or maybe failure. And again, I'm not blaming, I'm just noticing. They're short on temper, they're short on patience, they're short of time and the cash. So their currencies are running very low. They're looking for miracle, and somehow they have this misplaced thinking that we are magicians, right? Or maybe they heard that the practitioner had a successful case and now they equate themselves with that case because they're desperate. They want their hair back. And again, so you have to do very thorough assessment, especially in the background of chronicity of the issues, how long they have it, what are the other issues, before you decide, yes, I'm taking them on, or no, this is too complicated for me, I'm not. So landmark of good practitioner are several things. One is compassion, willingness to help patients. Another one is lucid clinical thinking, knowing your strengths and weaknesses, knowing which cases you can take on because you have somewhat chance to successfully assist them toward curative level. And of course, being smart enough to recognize that this is not your fight. So the better choice of action would be to refer them to someone as possible. So don't take on battles you're going to lose because you're not gaining, they're not gaining. There's a total waste of resources and time. And in the end, you start thinking of yourself as not successful, and they're thinking that too, because again, you picked the wrong cases. So I'm not advocating we abandon patients. I'm just advocating that we do most good where we think we can, right? So how do we know that we have possibility to alopecia? Well, again, shorter cases, less than a year in duration, has better outcome with less complications root-wise, so constitutional involvement. Ability of patient to be compliant, so to adjust their lifestyle versus they just want to come in our clinic, lay on our table, and have us do the heavy lifting. Again, not accusatory, but patients want us to live their life while they're in our clinic. Not happening because we cannot do this. We don't have either inclination or the power to do so. So recognize where the patient is physically, mentally, cognitively in their stage. If patient is willing to work on themselves, then that's much easier to work with. Because remember, you're only seeing them for an hour, once, maybe a few times a week if you're lucky, for a few weeks. And that buys you the goodwill. That buys you with certain successful elements of treatment visible. It buys you goodwill on a side of the patients. They thinking, okay, so we're a good match. I have some success coming to see her or him. Maybe I continue. And then maybe over the time, they work on their psychological side of the issue. Because remember, not everything's physical. And maybe they even push themselves to work a bit on the lifestyle changes. Because again, anything you successfully execute in a treatment time, like an hour with them, can be either extended, excuse me, by their willingness to work on themselves, self-care, or can be literally neutralized by their inability to do things for themselves at home, or worse, to go back to old debilitating lifestyle decisions. They're literally sabotaging everything positive that was gained to treatment. So these are some of the things they have to judge when you're taking on the patient. And it may take you a few treatments till you get the sense of who's in front of you, right? And so it's not a sure thing. It's not like we can look at patient and just say, hey, you're a good candidate. I think I can work with you, versus no, you're not. And I'm just wasting your and my time, right? So it's a hit and miss, and you get better over the time. So clinical manifestation, as I mentioned, alopecia could be mild, moderate, and severe. Severe cases are just that. They're severe, and they may take years of continuous treatment with questionable results. And that needs to be communicated to now probably desperate patients. Mild and moderate cases obviously have a possible better outcome. And again, you got to get the better sense of what you're looking at, right? If you can get the hands on maybe some lab work, you can look at the blood work to determine the state of the blood in Qi, that would be good as well. Maybe rule out or unfortunately acknowledge other complications, like often in a background of alopecia, there's neuroendocrine issues, mostly on the endocrine part, so hormones, but also neurological. So there may be a history of whiplash disorders, like multiple car accidents that affects the delivery of the nerve impulses peripherally through spine and centrally through the brain. So peripheral and central nervous system. Over under secretion of hormones, particularly from two master glands, right? So pituitary and pineal glands, which affect other nearby glands, thymus gland, thyroid, parathyroid, and then distal glands, right? Like adrenals and others. So, so this needs to be gleaned from assessment and factor in with the treatment, right? You got to look at the loss of hair. Where is it? Is there some reoccurrence of the hair? What kind of reoccurrence? So what worked so far, what didn't? And then we based our clinical outcome on these preliminary findings. You want to differentially diagnose fungal infections like tinea, as I mentioned. Tinea often will create this gray patch around, and if you have an ultraviolet blue light, you turn off the light in your room and shine the torch on that patch of hair, it'll become fluorescent. What do I mean by that? Well, let me go to our dermatology atlas for a second. Now let me go to tinea part, because I want you to see it. Here we go. So this is the tinea capitis in young boy on A. On B, we just turn off the light. We shine the, that blue ultraviolet light, because microsporum species, they leave photonic sort of imprint as they're eating keratin. Keratin is your hair, right? And so fungal infection can be visually seen with use of UV light in a dark room. That will point to you that you're looking at not just alopecia, but alopecia basically caused by fungus, which changes the picture altogether. We're still maybe treating alopecia, but now we have a complication. We know that actually it's caused by fungus, so we have to also defeat the fungus, right? So that's important as well, right? So you need to sort of rule that one out. So yes, please.
For that UV light, is that for any fungal infection that it would work?
No. Some fungal infections will not leave the photosynthetic kind of footprint. So, so yeah, but it's worth the try, right? Because what do we have to lose? We just then gain information about, and typically even without the light, you want to ask them how itchy that patch is. Generally, alopecia is not itchy unless it's caused by fungal infection. And if they're scratching a lot, there'll be, microdermal abrasions, so scratch marks and bleeding. There'll be redness, maybe even scarring. And so between those questions, do you scratch? Does it itch? Does it get red? When does it get itchy? Maybe triggered by So fungal infections may be triggered also by certain food. So the fungus exists there, but the symptoms can be increased by eating particular food. So that's usually starchy, there's lots of sugar, so carbs, and when those alter the blood and that blood comes under the fungal area, itchiness, pruritus increases, right? So again, we don't have to have a light. We can glean this through some of the visual inspection and questioning, but the light may give us extra layer of confirmation. Another condition we want to rule out is psychological issues. So trichotillomania. So a person is stressed, and when they're stressed, they pull the hair out. May not be like in the movies, you just rip the piece of your hair out. Maybe just slowly, as they enter the stressful state, they gently pull on a hair. Or maybe they're violent and they pull the hair a lot, right? So either way, there may not be the alopecia basically as we think, but it may be more stress caused than mechanically, right, caused. So when we look at geological and pathological involvement there, we're looking at obviously the two divisions, as we always do in Chinese medicine, the ones that are caused by excess, another one that's caused by deficiency. And of course, most of these are mixed. We're just looking at them here in isolation so we can see them better. But in real life, they're usually merged, right? The question is who's on the top, who's on the bottom, who's the root, who's the sort of branch, right? So excess patterns of food can take a significant role in maintaining alopecia. So as I mentioned, usually spicy, sugary, starchy food, fried food. So the stuff, lots of people eat in our culture. So burgers, fries, pizza, KFC, stuff like this, right? And often these patients may also be emotional eaters. So they're eating because they're stressed, as opposed to people who don't eat when they're stressed. So this generates extra heat, extra fire, extra inflammatory changes that affects the blood chemistry and maintains the alopecia, if not enlarging it. And as a part of this, it also denies delivery of fresh blood and fluids and waste management. So then we're looking at lack of yin and blood, right? And then when we look at deficiency patterns, we often see that they exist at the level of basic substance deficiency, so qi in blood. So qi here is in form of oxygen in the blood, nerve impulses. That's another form of a qi. They're not available to innervate that part of the skin on a head or anywhere else on the body. And that doesn't, so if the skin is not innervated as a form of qi or nerve impulses, then the blood is not drawn osmotically or neuroosmotically toward the area. And then, of course, we're looking at the blood deficiency. So quantity and quality of the blood that is delivered to the area may be lacking. So both quantity, so how much, and the quality, how good the blood is in terms of nutrients and everything. And that will affect not only nourishment, but the waste management, removing of what we call Sa-Qi or Sa-Yin, so metabolites, the cellular waste, right? And so that will, again, damage further nourishment through fluids, through nutrients and waste management. And often we see, if there is a regrowth, often we see those sort of thin, grayish kind of hair, even on someone who's very young, like 20 or 30 years of age. So that tells us that there is an underlying qi and blood deficiency. Nutritional indiscretions obviously play a huge role, and they need to be identified and need to be addressed. Treating patients with passive care, that's acupuncture, that's herb, that's lasers, that's a 7-star needle or plum blossom needle or anything else like creams, shampoos, will not be successful if a person goes home and continues with the old lifestyle, indulging in all this greasy, spicy, sugary food, fried food, because again, you need to make that assessment. Is the person ready to at least attempt to adjust the lifestyle? Otherwise, you're going to be blamed, right? They'll tell you that your medicine doesn't work. While in reality, it's not that simple, right? So personal hygiene is important. For example, small tips can make a huge difference in the long run. What are those tips? So telling patients that when they go in a shower, that's not a, I mean, in our words, we probably wouldn't tell them this. It's not a psychotherapeutic session where you stand 15, 20 minutes under chlorinated, hot, burning water because it feels good on your face, head, muscles, because it's relaxing you. The shower should be quick, especially for someone who's losing hair, and you should avoid absorbing too much chlorinated and fluorinated water, especially if it's very hot, because it dries the skin. The skin, if you look at it on a microscope, it's basically a plate, right? Like the scales that overlap each other. So what do you think will happen if we stuck our head, or patients stuck their head for 15 minutes under running shower? It will, and with the chlorine in it and fluoride, it will literally dry the skin and move those plates apart, and you're not gonna get much nourishment, right? And that will not help growth of the hair. If anything, it may cause more alopecia, right, and itchiness and so on. So small adjustment to shower routine or bathing routine is must. Using too much of alkaline soaps, so very strong soaps that strip everything, like natural occurring oils and everything, is probably not a good idea as well, right? Because that drives toward the yin deficiency as far as Chinese medicine. Massaging hair is must, and that could be done with the hands. You can provide them, let's say, if they're more inflammatory type, with the jade combs when they comb the hair, and it looks like one of those jade combs, so you can actually style the hair, because jade absorbs the inflammatory heat on a contact. Of course, there are some topicals we can provide them. Again, shampoos are important as well, looking at what kind of shampoos they're using and so on. There are a fair amount of herbal shampoos that may or may not work, again, depending on the type of person and their condition. But usually the commercially available shampoos are very strong, and they strip a lot of stuff. While most of the people with healthy pH of the skin and hair can tolerate them, obviously people with alopecia will not, right? Other things, some are tricky, like talking about physical excess, like people who overtrain, like elite athletes or endurance athletes, triathlon people. Lots of times they torture their body because their mind is stronger than their body, so they end up with the qi and blood deficiency because they love the sport, and the sport, kind of like that shower, is a part of a psychotherapeutic lifestyle decisions. When they exercise and they beat their body to hell, they feel good, right? But in the end, that leads to qi and blood deficiency, which may come through lack of hair, right? Because all that heat is coming through the top of the head, right? Excessive sexual activity, especially for men, less for women. For women, they will lose kidney essence more through more of a hemorrhaging, so heavier periods, or having pregnancies very close to each other. Like Chinese medicine usually points that moms should have 2 years apart between the children. So because you end up with the child that's born, and you have to nourish that child, breastfeed and others, so you need 2 years for your body to recover. Having pregnancies closer than 2 years may also damage the kidney jing and may result in alopecia. That may not be easy to address because resources are continuously depleted, right? For men, obviously, breaching subject of sexual activity and telling them that maybe the very thing they enjoy, intimacy, is not so good for them and they got to dial it down, is probably a no-go. And most of the practitioners don't want to even, breach that subject. But that may be also a layer of a problem. So it may not be the main one, but it is, according to Chinese medicine, because they observed it for thousands of years. Congenital deficiency of kidney, liver, spleen may contribute also to weakness in the blood. So these patients are typically borderline anemic, or they have some kind of blood disorder like sickle cell anemia, thalassemia, leukemia, unfortunately, hemophiliacs, or any other blood disorders. These will contribute eventually beyond just other symptoms to lack of growth of hair and alopecia. So as we can tell, there's lots of stuff that could go wrong. And so we have to identify it and then look at the ways how could they be addressed in non-threatening, non-traumatic way for patients, right? Not an easy task. So Dr. Tal already went through all these symptoms, but we'll go through them again. So we have blood heat generating the wind. So what we have here is, again, inability of blood to, or inability of body to regulate the chemistry of the blood. So blood, instead of being slightly alkaline, slightly above 7, so 7.2, 7.4, maybe some books even say 7.6, is sort of below 7. So it's becoming acid base, but not acid enough to kill the individual, but enough acid to change the pH and therefore become more inflammatory in a chemical way. And so that blood will eventually generate internal wind. How? So as the blood goes through a liver, to hepatic cells of the liver, liver cells or hepatic cells will use 3 or 4 times more of a buffer ions. These ions are called bicarbonate ions, and they come from pancreas, and the liver to liver. And liver use them kind of like, we use, let's say, dishwash liquid detergent to wash dishes. So water and sponge will not do it. We need something that's degreaser. So we, squeeze a little bit of that liquid dishwasher stuff on a sponge, and that not only helps to clean the dishes, but makes them sparkle, makes them smell nice, and so on. Well, think of these bicarbonate ions like a form of a detergent that liver uses to not only cleanse the blood, but maintains the proper pH. And that triggers usually a liver balance secretion. Liver is also an endocrine gland, so it's not just organ. So it produces, between other things, these 2 enzymes. One thins the blood, another one thickens the blood. If the hepatic cells have enough of bicarbonate ion and they can alter the acidic blood back to alkaline, the ratio, the balance between those 2 enzymes, the thinning and thickening, will stay balanced. If, however, liver and hepatic cells are failing for whatever reason to make the blood more alkaline, typically the enzyme that coagulate blood will tip over the thinning enzyme. So the blood will become a little bit more coagulating, which will increase more acidic nature or pH of the blood and create heat in the blood. From heat in the blood, you get this blood now pushed around the body. It washes the tissue, supposedly nourishing, but it's a bad quality. That affects the nerve impulses in the nerve conduits. So they start conducting themselves in increasingly faster than normal speed. And that gives the rise to what we call internal liver wind. Here, the liver is an endocrine gland that controls peripheral nervous system through chemistry of the blood. So if the blood is slightly alkaline, all is well. If blood is acidic and liver cannot change this, your impulses are raging in a nerve pathways. And you start having mild, moderate, or severe neurological deficit. So we would call this mild, moderate, or severe internal liver wind. Notice I said internal. So it's just a TCM terminology. And so at the mild level, you have itchiness, maybe numbness in the skin, somewhere in the body or multiple sites. At moderate level, you have what we call fasciculation. So you start having like an eye twitch, or you see pieces of muscles and skin contracting rapidly and releasing, right? So at severe level, you may be falling down, like someone have epileptic seizures, rolling your eyes till someone can see white foaming in your mouth, and like having major muscular seizures all over your body. So from mild, moderate to severe, how would body determine which one of these you would have? Well, that will be determined based on how fast the liver can go back to purify the blood. Most of the liver are good at sort of pooling the resources and keeping at the mild or maybe moderate level, but in some individuals may not stop there, right? So when you talk about blood heat generating wind, that's what we're talking about. That's why this whole pep story about the liver and everyone. So again, it may start with pruritus, itching, or paresthesia, numbness, the mild stuff. And then moderate stuff like vasculation. And these things also in weeks and months may also contribute to loss of hair in different parts of our body. So from head, eyebrows, mustaches, body, hair, take a pick, right? And of course, the more stressors the patient has and the lack of resources, they have to calm down and maybe sleep enough and hydrate, and the less the liver will have ability to maintain the chemistry of the and quality of the blood. So what do? So we help the body then, right? So with various ways and means. So here they're proposing the herbal, obviously, solution. So they say treatment principles should be here to cool the blood. Cooling means denying blood inflammatory pathology, so making it more alkaline. That will in turn extinguish the wind. Wind here is neurological deficit. So inability of liver pathways to be bathed in alkaline blood, right? Nourish the yin. So ability of the liver to add and balance those enzymes, particularly the thinning one, which is now losing to thickening one. And that in turn should result in regrowth of the hair, right? So formula we're pushing here is combination of blood. I just want you to understand the pattern. So blood stasis in hair follicles. So here we have body pushing that acidic blood close to surface. So most of the blood is alkaline, but there's like this almost bad blood like. So you know what it looks like? You have an oil slick on top of the, I don't know, ocean or lake, or simply, let's say you dropped a few drops of oil in your glass of water, and you'll notice the oil does not sink down, it stays on a surface. So think of this oil as being dirty blood, and the body's pushing it to the surface being skin, solely subcutaneous level, and toward like passing dermis and toward the surface of the skin. And so that acidifying blood will now affect the hair shafts. It will affect the delivery of the blood and chi and nutrients via capillary system, those tiny blood vessels. And it will keep all that, let's say, dirty blood, so what we call blood stasis, close to hair shaft. And that would cause like a local feeling of pins and needles, like someone took acupuncture needle and stabbing you on a surface close to those areas where you're losing hair. And then, of course, that will maintain loss of hair, the patches of where there's no hair or very little hair. And then, of course, there are systemic presentation of that, because this is close to surface, that person will have hard time falling asleep. And when they fall asleep, they'll have nightmares. So vivid dreams, you falling down, you burning, someone is trying to kill you, you're racing. So your inability of liver basically at night will be present in sort of this inability to create relaxing dreams. And so person will sleep very shallow. They'll grind the teeth, they'll sweat, right? And if you look at their tongue, you'll find lots of purple stuff. So maybe purple dots on the tongue. If they lift the tongue, purple sublingual veins. They may have teeth marks on the side. Their pulse may be deep or after 5 p.m., but more superficial between 5 a.m. and 5 p.m. And it feels irregular. So here they use the term rough. Sometimes maybe even we use the term wiry or even surging. So treatment principle here is to free orifices and invigorate the blood. So remove that oil slick like dirty blood that is sitting up under the skin, in invoking more of a lymphatic system action, so which will pull that blood and purify it and remove it. And that in turn may help regrowth of the hair. So these were the excess patterns. Now let's look at the deficiency patterns. Of course, these are not the only patterns. These are just the most common ones that the book is mentioning. So there's about 20 plus alopecia patterns. Here we're looking at probably what, 4 or 5, right? Let's see, I think, yeah, so 4. So so Qi and blood deficiency is overall chronic presentation. So it may come from constitutional direction, may come from lifestyle, combination of both, right? It may come to younger people who have prolonged disease or major trauma when they broke, I don't know, 10, 12 bones in some major accident, and they got lots of plasma back in their body, so foreign blood, right? And now they're recovering, but they're left, you know, maybe anemic. It can come from, for female patients who have very heavy periods. It can come from, I don't know, some kind of respiratory disorder like COVID, or overcoming TB or something like that, where body is just so deconditioned by this fight that resources to create proper quantity and quality of blood and Qi are just not there yet. And so this could be senior patients who, due to aging, are now having, again, problems with quantity and quality of Qi and blood. So in all those cases, we'll see weak constitution, low energy, low appetite, often low muscle tone, inability to physically exercise, problems with sleeping, depressive kind of state. So overall patient looks deconditioned, being young, middle-aged, or old, man or woman, right? So our goal here is to augment quality and quantity of Qi and blood. So through herbs, they usually push this Qi and blood tonics. We'll see later how we do this with acupuncture and maybe nutrition, right? So the last pattern we're looking is insufficiency of liver and kidney. So this is a deepest kind of deficiency problem. So first one was Qi and blood. This is now down to probably Yin, maybe even Jing, right? So it helps just quickly to digress. And we're gonna go through this, so the Qi levels, and I'm gonna flip this up this way so you guys can better see it. So here's pathology, right? So on the top, what did I do now? One sec. I think I pressed something. Sorry about that. Can you see it now? Am I sharing the screen?
No.
No, okay, I knew I pressed something I shouldn't. Okay, let's go back, yeah. How about now, yes?
Yes.
Okay, thank you. So here we see progression of pathology from Qi down to Jing. So according to some, we're looking at 5 or maybe 6 different layers. So at the first layer, which is functional, you notice that rough dotted line, I draw it. So we have Qi or superficial functional level pathology. Then if that's not addressed, you go to blood or deeper functional level pathology. And so if that's not addressed, then we go into structural pathology. So superficial structural one is Yang, deeper structural is Yin. And if that's not addressed, we have constitutional weakness, then you already have the Jing level deficiency. And that's what we call existential level. And so Jing Yang is superficial existential level, and Jing Yin is deeper existential level. So we're looking here on a liver and kidney Yin, so deeper structural level, with possibility the person has also some elements of Jing, either Jing Yang or Jing Yin. So Jing Yang would be problems within fetal development. So mother was maybe old when he conceived, like 40, maybe over, maybe father also. Mother maybe was hit by major disease, lived in war-torn country, caring for the child with not much resources and lots of stressors. Mother lived in actually normal country with lots of resources, but no support from family or spouse or anyone. Mother was a drug addict or substance abuse person. Again, no accusation, observation. that would affect the Jing Yang level because it would affect the fetal development, and that would later show. Jing Yin level happens before even conception. So mother and a father carry series of ancestral congenital issues. Typically in Chinese medicine, these issues will disappear within 7 generations. So about 7 cycles is needed for some of them to just, they're not passed forward for various reasons, time, mixture with another genome from another person, and so on. So Jing Yin level, there's not much you can do. It's just meeting of the 2 people and having a child. Jing Yang level, there's certain things that could be done. Of course, that's why some countries like China and Norway and Finland have what we call fetal education. They pay their citizens, young couple or whatever, middle-aged couple, to go in a school before they conceive. School is like series of lectures about what does it entitle to conceive. First, how you got to take care of yourself, build yourself back to as healthy as you can be. So that would unlock the healthy potential for your DNA. And of course, then when you get pregnant, it teaches you how to care of your body, for moms, for maybe a spouse, how to care of that pregnant mom. And then of course, then after the birth, of course, how to care for infant. So so these countries, interestingly, they identify that educating population is must, because then you end up with healthy citizens and taxpayers that they're not going to tax your health system as much, and they're going to work and give you you know, basically lots of money to taxes, and your investment as a country and society in them before they're even born is much warranted. Other countries don't look at that way, so they don't have these kind of educational classes. Anyway, so that's just a quick digression to these levels so you can understand the kidney and liver parts. Of course, here they're not actually saying liver and kidney yin. It's sort of implied because it's yin and somewhat jing. That's why they didn't put exact level of pathology of substance, right? So this typically happens to patients that are older, so maybe close to menopausal, so from 40 on, maybe even 50, so as the menopause starts, or maybe andropause for men around 55 and so on. And they have other systemic issues because aging happens, constitution maybe now it's playing, and so on. That will be more Jing versus Yin. So Yin would be more aging, Jing would be only what you carry from. So your genetic inheritance, the good and the bad, right? So treatment principle here is to enrich liver and boost the kidneys the best we can to prevent further deterioration at the Yin or Jing level. So you're basically slowing down debilitating unpacking of those bad parts of your DNA. So kidney will unpack this DNA chain anyway, but you're slowing it down. So degenerating changes don't come like tsunami on the body, right? Because there's no cure really. So what you can do is just slow it down. Okay, so that was the 4 of them. Let's look at some of the external treatments. So these exist in like billions of shampoos and creams and oils that everyone claims they're miraculous. Problem with that, of course, is that some work, some don't. How do we know? We don't, because it's individual thing, right? There's no one product that just works for everyone or for lots of people, because people have pathologies for different reasons. So then the products have to match those pathologies in order to be successful. And there's no universal product, right? So it's not like we have Rubik cube full of pathologies and then you just turn this cube till you set the right combination and then boom, the patient gets better. So we attempt things, right? Internally, externally. So nutrition is important. So we try to diagnose them with a specific level of obviously disease. Here is alopecia, but we also want to diagnose the syndromes, right? And then once we hopefully diagnose them precisely, then we would address the disease through syndromes, but we will still treat the disease. Tinctures, again, are a whole slew. I'm not going to even touch them because, again, we don't know what will work. And sometimes tinctures can make things worse, like losing more hair. having side effects like itchiness, redness, numbness, and others. So often it's a kind of hit and miss. So it's a scary part over here because people are desperate. And remember, for most of them, we're the last bus station. So they're like kind of short on patience, and so it makes it working with them not always as easiest. Acupuncture often focuses on movement of microcirculation. So reestablishing qi in blood, reestablishing waste management so toxins can be pulled from underneath of the skin, right? And you deliver better nutrients, oxygen, and other things. So for blood heat here, they're going with things like local points and systemic points. They're distal, so spleen 10, sea of blood, stomach 36, the motility point that moves the blood, and then gallbladder 20, so to alter a bit of a local delivery of blood under the scalp. For coagulated blood, we first work on the liver. We talked about that. So we help liver equalize those enzymes. Then PC6 and AG1 combined with this YAG1 increases systemic circulation. Sanjinjiao here is needled at 1.0 depth to activate the liver, right? And in bladder 17, of course, is also needled to increase circulation by making diaphragm go up and down a bit deeper. For blood deficiency, you reposition sort of organ functions. So you go to backdoor points that tells the organ to start behave a bit more efficiently. So that's a backshoe point for liver, ganshu, bladder 18 for kidney, bladder 23, shenshu. And then we add stomach 36 to move the blood. So first you tell the organs, okay, I want you to operate more efficiently. And then once they do, and the pulse changes, then you add stomach 36 to move now that blood and qi better. For, as we say, the last pattern, liver and kidney insufficiency, depending if it's on a yin or jing level, we use combination of backshoe points and source points, right? So we have backshoe point for kidney and source point for kidney. So that's bladder 23, kidney 3. We would add bladder 18 and probably Tai Chong as well, liver 3 there, source point for liver. Shui Hai, spleen 6 is here. And then needling again happens on 1.0 liver and then 1.2, 1.5 kidney depth. And then, of course, we can use local and distal points to basically make a treatment more specific to patients. So if there's more pruritus due to internal wind, you add points like gallbladder 20, you bleed that's way, do 14 to release that heat. For insomnia, you add Shishin Chong around Bai Hui, you add Shenmen, and maybe you add insomnia point. What's it called? Anmei, right? And at mastoid process just behind the ear. And so for hair loss in the temples, maybe we add more of a local points there. So stomach 8, gallbladder 8. If there's a problem with absorption of nutrients that contributes to qi and blood deficiency, we would add points like CV or REN 12, stomach 36, REN 6 maybe, to induce better absorbability in duodenal part of small intestine. If there's a more significant loss beyond just the hair loss on the head, but we have hair loss on the eyebrows and other points, we use points like Yu Yao local and triple burner 23. Empirical points here are suggested as well. There are, notice that it worked on some patients. So these are points off the grid, right? So 1 cent posterior to Bai Hui, right? So Fang Lao and Jin Nao. So 0.5 inferior to gallbladder 20. Often these points are tender, so it should be palpated and then needled. And then again, if for itchiness, we activate Dad's way. For greasy hair, you treat governing vessel, do 23. And for hair loss in temple, as we mentioned, we use local points, stomach 8. There are other sort of things that we could use. So ear acupuncture, so often Shenmen 0.0, associated organs like lung, kidney, liver. You can turn off the sympathetic system by using sympathetic nerve points, because if stress is involved, you can reset hormonal system. That's the issue with endocrine point, and spleen point is added to nourish the blood a bit more. And so these ear points can be kept for a week, maybe at the time, with the seeds or tack needles. Scalp acupuncture system can be used, and also needling around locally, as Dr. Cao told, like surrounding the area with the needles, may congeal more blood and qi into the area. Pricking the area can be used. So, for example, Vade zone can be used behind the popliteal area, pericardium 9, Eugene, so lung 10 can be used if there's a heat under the, or blood stasis under the skin. Those were points you can bleed. You can use Plum Blossom 7-star needle and gently hit the area with this blunt needles to increase slight kind of circulation, maybe a bit of a surface bleeding, because in some mild cases, this may contribute to better growth of the hair. So growth here is stimulated. Quality of hair is not guaranteed, right? And so this can be done over several local areas like stomach 8, gallbladder 20, gallbladder 19. You can use it on CV21. And for itchiness, again, you can use it over the areas, or like where it itches, or over the points to vent heat, like gallbladder 20, DO or governing vessel 16. Anmian, as I mentioned, can be added for insomnia, and use the 7-star hammer. We can use it on Yuan source points for kidney and backshoe points. So a laser can be used. Often it's a low-level laser. A person does not tolerate needles, and in some cases can work really well, but you need access daily to patients. So they need to be scheduled literally every day for a block of about 4 or 5 days a week, at least first 3 to 4 weeks. Unfortunately, in Canada, no one's going to commit to that. They have to be really desperate, because that's lots of money, right? Lots of time from work and life and so on. So nutrition can be addressed, of course, as well. So eating well-cooked food, avoiding too sugary, too starchy, too fried, too spicy, right? So almost eating like kind of plain, right, with not much spices, right? Massaging the scalp would be really good. Avoiding, as we said, standing underwater for too long in a shower. Too alkaline shampoos. Here they're suggesting some essential oil kind of food. So walnuts, sesame seed, seafood. Maybe some people may be allergic to these. So it's a hit and miss. So you have to see if a person can tolerate these, because these heavy oils, while in turn can stimulate nutritionally growth of the hair, they could also, in some cases, if not early, then maybe later, cause too much thyroxine stimulation from thyroid, and then that in turn stimulates the histamine, and that gives you allergic reactions, swelling, itchiness, and redness, and so on. So as we mentioned, advice for patients should follow things like avoiding sort of particular part of food, like spicy or fried, taking good care of the hair, and being patient, which is not what most of the people have by the time they hit us, right? Questions, comments?
Not for me, thank you.
All right, let's have a look at another video that I have here for you, but we're probably not going to be able to see everything. We'll put a link so you can watch it at a later time, because we have about half an hour left. So we're going to just skip the break and just go right into it. And we're going to finish a few minutes before 11 because I literally have back-to-back law and ethics. I don't even have a break between two courses, interestingly. So let's have a look at this video.
Everyone, my name is Natasha Mashinkovska. I am
I'm gonna
NAST 2
skip the introduction. We're gonna go into the
from you, and we have a lot of questions.
discussion. Here we go.
Very short. And then one of my patients who's of color, where you can see she kind of lost a little bit of her, or she has a little bit lighter color in the, under the hair where the hair actually was lost. And so that was another hint for her, because things happen on the frontal scalp that aren't just alopecia areata. You know, we all know this is an autoimmune disease of hair follicles with patchy or total hair loss from any area of the body. Lots of different patterns. You know, we won't go through that today because I'm sure you guys know about those, but they can be patchy, total, universal, diffuse, and a lifetime risk of about 1.7% in the general population. And we also use signs and ideas of how to look at active disease. And so some of those are listed here. Animal models are present, and that was really where we got our early research that sort of illuminated the field for us in alopecia areata. Lots of associations. Some patients have some of these, some patients have none of these, but many autoimmune diseases can be associated with alopecia areata, and those can make daily living very difficult. So that's another aspect that we won't go into too much today, but certainly in alopecia areata it's hard enough, but then we have something in addition to it and makes things very difficult at times because you have to kind of manage everything. As we said, you know, lots of different appearances, nails, backs of scalps, those sorts of things, and each individual patient, depending on what they have, where their hair loss is located, how easy it is to cover, how quickly they're losing hair, all of that is going to be something that is going to affect how you approach your life every day. I'm really going to talk much more about complementary kinds of things, but I do want to go through some of these ideas of what we think of as classic treatments for alopecia areata. So on the left side, classic treatments such as corticosteroids, light therapies, where we used to do a lot of PUFA, we do less of that now. That's Sorelins plus UVA light. And now we do much more narrow band UVB in different forms. Topical and oral minoxidil is now making its way on the field. Anthralin, an oldie but a goodie. Methotrexate, which is an way to suppress the immune system, and our big exciting one, topical JAK inhibitors, systemic JAK inhibitors, which are really taking a big field nowadays. Antihistamines are new on the scene. They actually reported some years ago in Korea, and more recently were picked up in a recent study that showed that even a certain kind of non-sedating antihistamine can be helpful. And then, of course, in my book, treatment for alopecia areata is not complete unless we refer our patients to National Alopecia Areata Foundation, because that's where you're going to get the information that you need, the real information, the true information, and all the updates on what's going on in the field. Now, some of the things that are maybe a little less classic, you know, that maybe your dermatologist doesn't talk to you as much about, what I try to cover in my patient clinic is wigs and hair pieces, how to use them, where to get them, hair cosmetics, scalp microneedling, PRP, which can be with or without microneedling, oils, like essential oils, cannabinoids. We'll talk a little bit about. There's not much data, and I don't talk to my patients about that. And then self-care. So here's a case, a 13-year-old of mine who presented with very diffuse and progressive alopecia areata. Oh, and I didn't have this on the slide, so I put this patch in. And he was recalcitrant to intralesional systemic steroids. So we decided to try squaric acid, which is a immune therapy that you can use topically to try to get a reaction on the skin that kind of tricks your alopecia areata, so the white blood cells go to this area where you treat instead of attacking your hair follicles. And this is a nice way to treat patients. I'm no longer allowed to use this in my medical center because they have decided that that it's not approved for any use by the FDA. So they won't pay for my malpractice insurance. But when I did use it, I had about 35 to 40% of my patients that actually did respond. Hypertrichosis can happen with minoxidil. So, you know, we've got these wonderful treatments, but many of them do have side effects associated with them. They're not always there, but sometimes they are. So we have to be careful when we talk to patients about treatments like topical or oral minoxidil. We prepare you for what you may experience. This is one of my patients who was already a bit hairy to begin with. And when we gave her topical minoxidil for her alopecia areata, it worked fabulously. But then she also started to grow hair a little bit past her hairline and started to need her eyebrows. So, you know, we maybe pulled a little bit back on minoxidil, but she was very happy with the hair growth. So she was able to continue to use it. But it's a little scary. So, you know, as a physician or as a healthcare provider of patients with alopecia areata, I try to remind my patients what to look for so it's not an excuse to stop. Now, this is a busy slide. It's got a lot of very technical things on it, but really what you want to get out of this is that because there's been so much wonderful research in alopecia areata in the mouse model, we have been able to determine that there are certain chemicals, certain processes that are associated with the disease process, and now we have drugs that actually block that. And that is the wonderful, wonderful information presented here, which was a composite of work from 25 years ago and more recent work by Angela Cristiano, where, as you can see on the left, the gentleman used a JAK inhibitor and really had almost complete, if not complete, hair regrowth. There's lots of mediators that are part of this process, and we're still trying to figure this out. And as a result, there are more than 3 of these that are being looked at in laboratory testing now, as well as in clinical trials. So, you know, there's a way you can sort of look at alopecia areata. And one of those ways is that we actually have no FDA-approved treatment. So really, any treatment that we use can be considered experimental because nothing is really approved. You know, we use for patchy disease, we tend to stay with the topical medications, maybe injections if you're less than 50%. But for the totalis and universalis patients, we not only use those modalities, but we also move to other things, more internal treatments, such as prednisone tapers, methotrexate, I talked about the lights. Those are really important things that we can use for our patients. And they can work and they can also not work. And so that's why we have so many of these treatments on the list, is because, you know, if you had one good one, you probably only use that one. But we have to have a number of them because different things work for different people. I talked about contact immunotherapy, which is what the young man had to treat his alopecia areata, and I've also talked about the JAK inhibitors. So nothing yet FDA approved, but we're hoping. There's been a number of studies looking at treatment of disease, alopecia areata in adolescents, treatment of severe alopecia areata and variants, and even treatment of the eyelashes. So you can better believe that we are all really waiting with bated breath for some of these newer drugs to come to the market so that we can really address this disease in the way that it needs to be addressed. So just for an update on current trials, Pfizer's really moving forward. They have an oral JAK3 inhibitor. So it's another JAK inhibitor that we talked about that kind of blocks that one metabolism or one metabolic pathway, and they have been granted breakthrough therapy designation by the FDA for moderate to severe alopecia areata, and so they had very good outcomes in their phase 2 trial and went to phase 3, and so their trials are ongoing right now. There's Concert, which has a drug that has yet to be named. It's called CPT 543. And they have a drug that's like one of the existing JAK inhibitors called ruxolitinib, and it's actually an altered form of that drug. And they're actually running their phase 2 trials with an open label extension study. Unfortunately, Aclaris did not have the right endpoints to continue their studies. They actually didn't reach the endpoints that the FDA needed to move it along, so that trial is no longer underway. But we do have a drug from Lilly that I unfortunately don't have on the list, and that's going to be coming on the scene, and we're going to be talking about that very soon in our talks as well. Now, what about some of these emerging treatments? How do we deal with patients who, you know, are either failing their topicals, they don't want to take any more steroids, they have potentially a side effect from some of the other things like I talked about, the extra hair. And so what do we do for those patients? What's sort of emerging? Well, dupilumab, which is also called Dupixent, is a drug for atopic dermatitis, but there have been a few cases of atopic dermatitis patients who also had alopecia areata, and they got improvement with the use of dupilumab. Now, we don't have large-scale studies for this, and unfortunately, it's also reported in a couple of cases of alopecia areata to cause the alopecia areata. So we don't want to run off without really testing this, but we know that maybe there's something to be looked at there. And then there's ustekinumab, which is a long-time psoriasis drug, and there are several case series showing regrowth in alopecia areata patients with this. So what about for folks who don't want to take a systemic agent? The dupilumab, ustekinumab, and even the JAK inhibitors that are so exciting for the most part, unless they're topical, are going to be injected. Now, some of them are going to, the JAK inhibitors are going to be oral, but the psoriasis medicines, the atopic dermatitis medicines are going to be injected. PRP is another way to potentially treat the disease without treating the whole body. So right now we have some studies out that show variable results in alopecia areata, but it seems to be able to help localized areas of treatment, localized areas. So if you have localized areas, maybe that's a good way to do it. Because for the most part, PRP is injected, you don't want to have to use the whole scalp in order to get the right outcomes. And so we want to be careful when we have patients that are asking for PRP. We want to do localized areas for now. Microneedling, it seems like there's some early wins in the data. It depends on what you're using. So in microneedling, we usually use a small handheld device that has really tiny needles on the end of it, and you just kind of run it across the skin, and it causes these little tiny holes. And then you usually rub something on the top. So that could be minoxidil, Rogaine, steroids, it could be PRP, and at this point, we don't know how it's going to shake out because it's really dependent upon what you're going to use. Now, what about oils? You know, we have a study in alopecia areata from many years ago where essential oils were used and seemed to help grow hair. But unfortunately, no one has been able to recreate that study. And so when I look at oils, you know, I find that they can be actually somewhat irritating. In my practice, we see a lot of patients with very sensitive skin. A lot of my alopecia areata patients have atopic dermatitis or eczema, or at least sensitive skin. So you have to be careful using things like coconut oil, jojoba oil, argan oil, castor oil, even olive oil, can all be somewhat of a skin irritant or cause dermatitis. One of the the biggest offenders is tea tree oil, where you can get quite a lot of irritation. Shea butter is also something that people think is natural. You know, my patients always talking about what's natural, what can I use this natural? And I tell my patients that natural can be good, but you know, snakes and tigers are natural and they will kill you. So you don't want to always have to have something natural. You want something that's natural, healthy, and that works. What about wigs? Well, next little bit, we'll talk a little bit about wig use because I think it's very complex. You know, it's not a simple recommendation to just go get a wig. You know, picking the right wig, maintaining the wig, the proper utilization of the wig, all of that really takes time and energy. You know, do you wear your wig all throughout the house because you might walk past a window and the neighbor may come and knock on your door? And so I think that when you recommend a wig to your patient, you need to have a multidisciplinary approach with their primary doctor, the specialty doctor, you know, which would be me in this treatment, and the person who's going to actually help with the wig. So we want to be very broad and open with our patients and let them talk about their feelings in terms of a wig. Cost is another factor. Natural wigs are natural hair wigs are very expensive. I'm really more of a fan of, you know, what people feel like looks good on them. Caps or capless, it's really up to the patient. I really don't like glue because I think it doesn't allow you to take your wig off and actually treat your scalp, and I think it can be damaging as well. I think that hair cosmetics such as you know, things that you sprinkle on the scalp or use to color the scalp can be very helpful, especially if you just have patchy disease. So I always ask my patients about their comfort level with wigs and hair cosmetics in both the physical and psychosocial kind of way. We don't have much time left, but I did want to just mention cannabinoids because that was one of the questions that came in or you can call it medical marijuana. Unfortunately, at this point, we have really no scientific basis for treatment. When I Googled, there are certainly some websites that suggest that cannabinoids can help because there's some reported anti-inflammatory options or outcomes from use of cannabinoids. But I think that we're really, really young in the science of cannabinoids and skin disease. So at this point, there's no specific data for this helping. I would be very concerned about this even being absorbed through the thick skin of the scalp and maybe causing some problems with some of the other treatments that you're doing. So I would be very open with your physician if you decide that you want to try this. Finally, don't believe Dr. Google when it comes to treatments for alopecia areata because you can find almost anything on a website or any website. And I don't want you to go down that rabbit hole. Really use the NAF folks who give.
Okay, so we're going to stop here. You do have a link for a reminder of the video. So to recap, today we looked at alopecia areata, so hair loss, and next week we're going to look at the boils, right? So questions, comments about what we covered today?
I have one quick question.
Go ahead.
It's about the when you were talking about the scalp and there being fungus. So is that not a representation of dampness?
So fungus is generally seen as a damp heat or toxic dampness as far as how we call it in Chinese medicine. So it's not strictly just a dampness. It's always there's inflammatory element. Now there are variations on a theme. It could be damp heat, means dampness is the major pathogen, heat is minor, so 70-30. Could be heat damp, other way around. Could be toxic dampness, means the heat has elevated to toxic heat level and it's major, and dampness is minor, or damp toxicity, which means the dampness is the major and toxicity is the minor. So these are usually 4 variations on a fungus as far as TCM.
Thank you. And I know we got to go, but I just wondered if you could tell me the meaning of lassitude.
Lassitude means, well, different things. I mean, depends who you're asking. Could be physical, mental. It means exhaustion, basically. So patient presents with lack of resources available to them. They look deconditioned mentally, physically, cognitively, spiritually, right?
Thank you.
You're very welcome. Thank you. Any other maybe questions, comments? Okay, well, so thank you for being a part of class today, guys. I'll probably see some of you in some other of the 3 courses I'm teaching today. If not, I'll see you next week. Bye, everyone.
Thank you, Zoran.
Good afternoon, Zoran.
Thank you.